Sun Life Financial is proud to partner with Canadian HR Reporter and Thomson Reuters on the following roundtable, which takes an in-depth look at disability management. Sun Life is committed to working with Canadian employers to help optimize the physical, mental, and financial health of employees and to support your organization in maintaining a healthy, engaged workforce. For more information, visit www.sunlife.ca.
Disability claims pose a major challenge for employers, with stress and mental health issues forcing a lot of workers off the job. Canadian HR Reporter recently hosted a roundtable in partnership with Sun Life Financial to look at some of the issues around disability management. We wanted to explore the reasons for rising disability claims and find out where employers and employees can turn for help. In this video, the fifth of a 7-part series, panelists discuss ways workers can find quicker resolutions to mental health issues.
The topic that comes to mind is the concept of telemedicine or telehealth. And of course, Mike, your company does have some solutions that are very well done in that space. There's a fair number of companies out there that facilitate these sort of transactions. At the end of the day, according to the research, about 80% of all healthcare practitioners, so physician-patient interactions, do not necessarily need to take place with the physician physically touching or physically being in the presence of the patient. So it's a huge burden with regards to people taking time off work, travel times, wait times, all these sort of things with regards to that. So when you have the capabilities to deliver type of healthcare that is not sacrificing quality whatsoever for 80% of the cases out there, it just makes perfect sense to go ahead and do it. So this is what companies that are providing virtual healthcare services or telemedicine or telehealth are actually focusing in on, is providing these types of services without all the other issues associated with the travel time. And it's actually a driver of absenteeism when you look at, from a health perspective, the amount of time that people have to take off to get to this sort of solution. So that's very much front and center, and this is very much relatively new to Canada. It's been around for a few years now. One of the barriers has been the fee codes associated with how the physicians or the primary healthcare practitioners are actually billed back for their services. So once the fee code issues were sorted out, at the end of the day, this made for a very strong value proposition for employers who are worried about time off work to do the sort of things or to expedite access to care, and it does make for a good business case and a good business model for delivering these types of services.
Yeah, there's two things I want to highlight just to add to that. I mean, there's the whole idea of the whole category of telemedicine is quite huge, and just like what we're talking about in terms of the pharmacogenomics, even though an employer can have a telemedicine solution available to all employees, I think at a minimum, look at the barriers for people who are on disability. So somebody needs an immediate consultation. They're with a family doctor, they're waiting to see a psychiatrist, they would wait for a fair bit of time actually to see a consulting physician or a consulting specialist. Having that available, that consult available through a video means, it just makes complete sense. And from another point of view, it's not just the physician visit, it's not just the video, that's one aspect. In terms of mental health care and treatment, but also interventions for things like pain and for things like insomnia, we know and we've known for years that cognitive behavioral therapy is very effective. It's one of the most researched means of therapy. The problem is that there are a lot of barriers for the individual to participate. It takes time, you've got the kids at home, you're taking time off work, or you have to travel, you have to find somebody who's qualified. There's the cost aspect of it because very often those types of therapies are not fully covered by the public health system, or if they are, you're probably too way down the path in terms of a waiting list. What's happened over the last little while in Canada is that we've realized what some other areas of the world have realized for a while, which is that cognitive behavioral therapy delivered in an internet or a digital format is as effective and in some situations more effective than face-to-face. So at a minimum, it reduces the barriers of cost because it tends to be more cost effective. At a minimum, it reduces the barrier of being integrated into a person's realistic life structure. But again, the research is pretty hard to refute that modality of having a digital platform where you're served up some of the homework and the modules for cognitive behavioral therapy, in particular if it's supported by a therapist who's not face-to-face with you but is there for support, is as effective as face-to-face in most situations.
The access is key, that folks actually do have access to that service, but what we're also seeing is that stigma attached to the notion of I actually have to physically go, I have to physically be in someone's office, someone might walk in that I actually know. That is removed by moving that to a virtual comfort in your own home. You now can do that when you need to. And again, back to the younger generation, they are more and more comfortable interacting on a mobile device, whether it be a laptop, their phone, etc. So that virtual is going to be key as we move forward. We've also seen just that notion of connection is even more so important. So from a rehab perspective, a few months ago we launched face-to-face virtual rehab connections, and over 300 now instances. Only 3% of those instances did someone say, I didn't like that. That was huge for us to actually see. We were a little leery of, are people going to go, yay to the notion of moving away from that in person to online, and it's been quite well received.
I actually thought you were referring to the notion of the private healthcare system, which I know is very controversial. And I mean, I'll start by saying I do think we have an excellent healthcare system in Canada, but there are flaws, including excessive delays to see specialists, get tests done, et cetera. And it can be as simple as you got someone who needs an MRI and you're waiting 3 months to have it done, and the employer is waiting 3 months to have them come back to work. And of course, we've all heard of someone who just says, I'll go to Buffalo and pay $800 and get the MRI done tomorrow. And I know that there are private companies that will help organizations or help individuals navigate this sort of private/public system and find them the fastest way to get treated, whether it be privately or publicly. And that's something to bear in mind as well. Again, I know it's controversial, but again, you can get an MRI done tomorrow. Another story I heard of someone who needed to see a specialist. They were told they're going to be waiting for 16 months. Instead, they were given an appointment with a specialist who I guess is off the public system. This was in Quebec. And as they described it to me, they went to an office on Sherbrooke Street in Montreal and walked into the waiting room, and they assumed there'd be a million people running around, as is typical in most doctors' offices, and there was nobody there. So they actually thought they were closed. They thought it was the wrong day. But then the doctor sort of wandered out of his office. There wasn't even a receptionist, and said, okay, Mr. So-and-so, I'm here to see you now. And as he described it to me, I walked into the doctor's office and I sat down, and the doctor said, okay, tell me all about it. Take your time. Tell me everything that happened. And he said I was so flabbergasted by this because I wasn't being given my 3 minutes before the doctor had to move on to the next patient. But he sat there, he said, for about an hour or so, and got a very detailed, I think it was like a 7 or 8 page report about a week later. So that's available privately. Again, I know it's not very popular, but that's kind of where I thought you were going with your question. And I guess it is something for employers to be aware of if there are circumstances where they don't want to or can't wait for months.
There are other services available that are not necessarily in the private sector. So we've recently partnered with Medical Confidence, which allows us to actually find that service very quickly. And again, lots of success with that. It takes the doctor out of the general practitioner out of the equation from the perspective of it's no longer their network, but it is actually a well-connected network across the country. So just connecting people is key, and I think we just need to actually move a little bit towards, again, education. What can we do to help these members get themselves their own access to care? Everyone is very reliant on your own general practitioners, and they are not the key to everything.